PremedGo is a platform that tells you about who you are and where you are at now. We want to make preventative health as an investment, not a cost. So we are building something that has value, brings value, and commands value. I think PremedGo will be the go-to platform for prevention. The main idea behind PremedGo is using AI to make preventative healthcare smarter. I've always wanted to do something. I've always had this entrepreneurial edge, and I've always believed that I can't fail. For some reason, even as a child, I just think I can't fail. I know there will be obstacles. I know there will be challenges, but I've never thought I could fail. What can happen is I can learn from an incident of failure, but actually failing, I don't think so. Because failing is giving up. For me, I want PremedGo to be that platform that continues saving lives.
Hello, my name is Nivi Malcolm. I am the COO of PremedGo, and we have with us today George Nimfor, who's the CEO of PremedGo. And today we'd like to talk about the story behind PremedGo, what inspired it, how the company was built, and what its future is. So George, why don't we start off with first saying what inspired PremedGo in the first place?
Thank you, Nivi. With PremedGo, it's more a personal experience with when, I think back in 2022, my mom had a scare. I visited my mom, we were having a conversation, a family conversation, then all of a sudden she passed out. My mom is one of these people who go to the hospital like a supermarket. She treats a GP surgery as a supermarket. Every little thing she goes. So it was quite unfortunate that happened to her. So we got the ambulance coming. They asked us, okay, what's really wrong? I said she's very fit. My sister said she's fit because that's what we know our mom to be. They did some tests, but they couldn't find out what was wrong with her. And at that point, we were like, what's going to happen? So they took her to A&E. They couldn't really find out what exactly was wrong with her. And then they followed on to take her to, I think, a specialized unit where they ran some tests on her. And they found out she's got some underlying conditions, which was quite interesting because she regularly visits the GP. So if there's any underlying condition, it should have been picked up. But then again, after various tests, we found out that this is not something that you can actually pick it up unless you do like a thorough health check.
Got it.
Blood test and all those bits. So that was how the whole thing started. But the interesting bit was, as that was going on, I was doing my first master's at Oxford, and I had to do a dissertation. So in my dissertation is like, I need a topic, something to write about. So this is where the entire journey started. I used my mom's personal experience on preventative health, prevention, how many people are like my mom, thinking they really fit, they're healthy, but within, they've got underlying conditions they don't know of until something really happens. So that's how the whole journey started.
Okay, so I guess what you're saying is there's a professional and a personal reason as to why you felt there was a need for something like this.
100%.
And how has your background and experience in healthcare helped you in shape this business?
So my background is more in primary care. So I worked for a group of GP practices, which set up an organization within the NHS, worked in primary care. So in primary care, one of the biggest challenges are prevention and low funding for prevention, and also behavior, because a lot of people don't really want to spend money on prevention. It's like, why should I spend money on prevention? I'd rather wait until something. And also a lot of people are scared to find out that I've got this condition, they rather wait. So it's been a behavioral bit, but my background within the NHS actually sort of shaped the whole business or the whole idea for me.
Okay. And what would you say were your biggest challenges earlier on?
I think trust. I think trust has been one of the biggest challenges because it's like, people don't, when you start an idea, people actually have doubts whether, what is the purpose for the idea, and that becomes quite difficult because everyone you speak to wants to know more about you. They've never heard about you. They've never heard about this idea before, and it becomes very difficult because we are so positioned within the B2B market. So even getting your first client becomes very difficult. What if they give you money and you run away with the money? So that's been one of the biggest challenges.
And if you had to say, what was your one breakthrough moment when you thought, okay, this is working?
I think when, so we had our first client, and when we had a meeting with the first client, there were two things going in my mind. I didn't really think the client is going to come on board. And if the client will come on board, I thought the client will say, okay, listen, I'm just going to spend maybe £50 per employee. But interestingly, the client, after the conversation, said, listen, I'm going to spend £500 per employee. So then I thought, listen, there's something that I'm missing here, because I wanted someone to test the platform, test the idea, but now the person actually wants to pay, and this payer actually believes in prevention for his employees. So we are sort of on the right track.
Okay. And how would you say the company has evolved from those early stages?
I think it's great. It's like even having you shows that a company has actually evolved a lot, and now we're doing things that I thought we would do maybe in the next 2 years. So yes, we've got Innovate UK. We've been approved to use NHS website content for our content and stuff. We've got Oxford University Innovations and the university on board through their incubator. So it's like, from an idea of whether this is a good thing to do, to now even having this, it's just
it's the validation.
It's just
it's the validation.
Amazing,
So what would you say is PremedGo's mission in one sentence?
Interesting, isn't it? It's interesting. So the mission is that we want to make preventative health as an investment, not a cost. That's what I'll say. So prevention should be an investment, not a cost. Hopefully I've answered this. Yeah.
Okay. And how is PremedGo changing people's and organizations' view on preventative health? Because obviously that's been the biggest challenge. I know that the market is changing, the industry is changing, and the views are changing, but it's still a challenge.
I think now we've got people thinking about preventative health, where people normally used to think about reactive. So a clear example is people normally are looking for where are hospitals, where is the gym, where is this, where is that. Now we are trying to tell people think about preventative health, where we put all these preventative healthcare providers onto one platform, so people know where to go if they need health checks, eye tests, anything prevention, anything that they need to start doing before things get worse. You've got one platform. You don't have to go on Google. You don't have to go on ChatGPT. You come on a platform with a lot of providers on there, with their prices, with their availability.
Yeah.
So that's actually changing the preventative health sort of agenda within the country or everywhere we've spoken about PremedGo.
Okay. And then it would be great to hear an example or a story where PremedGo has made a real world impact.
Interesting. So there are quite a few where people actually reached out to say, listen, I didn't really want to pay to have a health check. I paid, had a health check, and I actually found something which is similar to your mom's story, because normally I use this story when I'm approaching companies to actually buy PremedGo as a benefit package for the employees. Also, there was a case with one organization where they actually, it did save a life of one of the employees. They found out something that was quite critical, which they wouldn't have found out. So it's this, when you hear these sort of stories, it's actually motivated. It's like you're doing something.
Yeah.
You're not only creating a company to employ people or creating a company to help the economy, but you're creating value that helps human life.
Yeah. And then talking a bit about the future, so where do you see PremedGo in the next, say, 5 to 10 years?
Yeah, yeah. I think it's something we need to work on, isn't it? But in the next 5 to 10 years, I think PremedGo will be the go-to platform for prevention. So when anyone hears of PremedGo, it's like Google, it's like ChatGPT. That is how PremedGo is going to be. It's going to be like the go-to platform for prevention. If anyone is looking for a preventative health care provider, they will go on it. And one of the things in the next 5 years, 5 to 10 years, I see PremedGo becoming is like that commanding voice within the preventative healthcare space, whereby every country that PremedGo becomes like the front door of healthcare. So
Yeah.
before anyone goes to the GP, before anyone goes to the main hospital, they will actually have touched some elements of PremedGo, which would then drive or direct them as to what sort of healthcare needs they need. Because sometimes people don't know what they need. They need a bit of guidance, and you can't actually go to your doctor to get that guidance. But if you know what sort of doctor you need to, it's like an example is if you want your child to see a GP, you need a pediatrician. But if you don't know that this is what you need,
Yeah.
you just be looking for. You think any doctor at all can help you.
Yeah.
So this is where
So-
next 5 to 10 pre-med.
So yeah, so basically everybody should be using PremedGo as the first call. Like my
100%.
child is sick, what do I do next?
100%.
PremedGo will give me the answers where I need to go, what I need to do.
100%.
Okay. And in terms of international expansion?
So great. So we've started speaking and partnering. We've partnered with some few big clinics in Ghana where we want to start piloting PremedGo, and it's gone quite well because these clinics are on board. We now need to make sure we push and drive that agenda because PremedGo is a good fit for every country, but we want to start from Ghana, driving through Africa. Then we also want to start next year piloting in North America, in the US, and sort of get that expansion going so that if, let's say, somebody uses PremedGo also can become a passport for other people. So if, let's say, you're on holiday, you have a bit of a scare, or you woke up, you're not feeling great, and you are in, let's say, America for something, you could actually look on it. A provider might be closer by, and you can actually have that easy access.
Okay, great. So one thing obviously which is very topical and which will be a key part of the PremedGo platform going forward is AI.
Yeah.
So how do you see AI shaping the future of preventative health?
Yes. So this is the AI is a buzzword. It's not really a buzzword for PremedGo because the main idea behind PremedGo is using AI to make preventative healthcare smarter. So what we meant by that is that when someone goes on the PremedGo platform, it helps them predict. So it will predict based on the user trend or the user data or how the user interacts with the platform. It will help you predict. It will do a bit of risk scoring. Then our platform will then direct you to the clinic that you need. So what happens is the platform knows you, interacts with you, knows your needs, and then tells you where you need to go. Our platform will not treat people. It will just be there triaging people, but it will give people the right sort of care. And also, once the whole care thing has been dealt with, it will then design a personalized healthcare plan for each user on the platform.
Okay.
So that's how AI will be used in PremedGo.
And how do you envision PremedGo's role in improving population health outcomes globally around the world?
So you see, I think every government or everyone talks about prevention, investment in prevention. But what we want PremedGo to do is empower employers because they run most of the global economy is run by companies and organizations. So we want to empower employers to actually take the charge or start leading on prevention, giving their employees preventative healthcare measures, options, so that they can fight not only absenteeism but also improve the life of their employees. So that is how we see PremedGo taking the charge. So our focus is going through employers and making sure employers can buy into the PremedGo idea so we can roll it out to everyone at the end of the day.
Okay. So George, we would love to know, what is PremedGo?
Very good question. So basic without, going through the formal. So PremedGo is a preventative healthcare platform that actually, the way to explain it to someone is, so if I meet someone on the street, way I will explain PremedGo to the person is, PremedGo is a platform that tells you about who you are and where you are at now. The question will be, what do you mean? Who am I? Where I'm at now? So then we start a conversation as, listen, do you know what your blood pressure is? Do you know anything about your personal health care? Do you have enough data about your personal health care yourself? Or is it a data that's being kept by your doctor? So this is how I'll normally frame it when we start a conversation. But PremedGo is a preventative healthcare platform whereby we have access to loads of different clinics in terms of prevention, from physical health, mental health, and also all these other telehealth in terms of prevention. So with PremedGo, it's a platform where when you come, you get all these providers on there. You get easy access to them. You get easy access to their diaries. You get easy access to their pricing. So you know how much you're paying for a GP appointment or a health check. You know how much you're paying for a blood test. You have other alternatives on the platform, and you can make that informed decision and choice to choose. That's one aspect of PremedGo. The other beauty of PremedGo is it actually helps you. So when someone wants to shop, they go to the store, and when you go into the store, you get an attendant and you're like, okay, great, I want a shoe. Then your attendant will sort of help you in a good store, signpost you where it is. If you get someone interactive, they interact with you to ask you what type you want. Can I get it from the store? This is exactly what PremedGo is. We are creating an AI system that will interact with you, know you, help you, signpost you, and actually develop a personalized plan for you that you can always come back to it. It's like you have a shopping basket. You can always come back to it, look at what you couldn't do, and then try and fix what you couldn't do in terms of your healthcare. And that is what PremedGo is. The other aspect of PremedGo, which goes to employers, is that it's a platform where an employer gives the access to the employees. The employees can then go on the platform and book a health check, book a mental health, book any sort of test that they need that will not normally be covered by insurance or any other packages they have within the organization, and they can actually take charge of their health. So that is what PremedGo is.
Okay, so it is a marketplace at the moment.
Huge.
Anything to do with preventative healthcare. Yes. So when you say anything to do with preventative healthcare, so it'll have your generic health checks, but it'll have different type of health 100%, checks as well. So gut health, hormone health.
Also,
okay, perfect. And the plan is to incorporate the AI, so it has a personalized recommendation plan.
Yeah.
And then who are your customers? You mentioned employers, so it's obviously B2B.
Yeah.
Is it B2B and B2C?
So it's B2B and B2C. So our main focus is B2B, but we've been there where someone has booked a health check randomly. We've got like 5% of our current users without the AI. We've got 5% of our users booking, and then we've got the remaining 95 are all B2Bs, employers, then the rest are just individuals. And sometimes we get employees who have used it and then have come back to top up on a personal side for their family members and stuff like that. And that's what we sort of see happening, or that was what is going to happen once the AI is actually ready, because you get an employee who is being given access to this, but would then come back to subscribe and give access to their family members.
Okay. Yeah. So currently it's as simple as going and download. So it's an app on
Yes.
Android as well as
Yeah.
iOS. Is there a web app as well?
So there's a web app we've actually created now that we will be promoting, so people can actually have access. Those who don't have apps or don't want to use an app, they can actually use the web app and also book. It's similar to the app. Yeah.
Okay, so from an employer point of view, I assume the employer agrees, the company agrees a predetermined amount with you,
Yeah.
and then allocate that to the employees who then
100%.
go on your app and book
Yes.
whatever they want to book.
Perfect.
And what's the time period for a contract? What?
So another beauty of it is because we want to drive prevention, and what happens is when an employer gets access to it, they've got 12 months to get the employee to use it. We want the employees to have, if not anything, to have like a regular or a basic health check done, so they know about themselves. So we have that 12-month span that the employee can actually use it, and the employee doesn't only have to use it within the town they live. They can use it anywhere, any clinic on the platform. They can use it. They can use it if they're on holiday in the US and they find a provider on there. They can use their credit. So that's how it
Okay,
works from that
great.
point. Yeah.
Okay. And when was PremedGo formed?
So PremedGo actually, as I said, PremedGo came about from a personal experience. Then I did my dissertation on PremedGo. This idea, in my dissertation, I was talking about how AI can actually facilitate preventative health and support the whole healthcare system. But the interesting thing is, once I did my dissertation, I wrote about PremedGo. Then I registered a company at that point, just to encourage me, because I was working within the NHS and I had a sort of a good job at the time, so I didn't want to destabilize my job. So I just registered it as, I'll come back to it one day. So back in 2021 is when I registered it. That was when I did my master's at Oxford. Then after that, I then decided to take it a little bit seriously. So upon completing my master's, I am an accountant, finance background. So I was like, okay, great. I need a very business background, because you could, no disrespect, but accountants are quite, narrow in their thinking. I know no accountant might end up liking me after this, but very narrow in their thinking. So I was like, okay, I need an MBA. Not that an MBA will change the world, but it'll actually give me an open mind, open access. So I then went to Cambridge to do the MBA. So from Oxford went to Cambridge to do the MBA. And as I was doing the MBA, every assessment, every contribution, and you can check with my class, it was always about PremedGo. So I was then shaping. So for me, my MBA was all about shaping PremedGo. And that is how I did my MBA. So my assessment, everything, did it all about PremedGo. Got a lot of feedback, academic feedback, and also personal feedback from colleagues, and contributions and inputs from colleagues. So fast forward, after my MBA, that was when I would say PremedGo actually kickstarted. So back in 2023, that was when we built a first MVP, and then we started trying to get a word out there, pitch to people, and things like that. So it started, technically started 2021, but the business actually started back in 2023.
Okay. So it's obvious that your personal background and work experience has really shaped your decision making PremedGo. You talked about working for the NHS. It would be great to find out a bit more about that and how that influenced in PremedGo.
So that's very, so I worked within primary care, which is more with GPs and within a local healthcare system, working in finance as finance director. But I think, so even with working within the NHS, I like coming up with innovative ways of doing the same thing. So we can't be doing the same thing, but I always want to come out and do something different, something more efficient, and effective. Maybe because I'm an accountant, I just want own value for money spent. I don't know, but I've been this type, even within my colleagues and people around me will always tell you that that's how I always look at things. Let's innovate, let's do something clever, let's do something nice. And that background, I think, actually led on to maybe PremedGo, led on to me doing this. But even as a child anyway, I've always wanted to do something. I've always had this entrepreneurial edge, and I've always believed that I can't fail for some reason. Even as a child, I just think I can't fail. I know there will be obstacles, I know there will be challenges, but I've never thought I could fail. So that's been what actually drives me, and I don't think I can fail anyway. People can say whatever they think about failure, but I don't think I can fail. I think I can. What can happen is I can learn from an incident of failure, but actually failing, I don't think so, because failing is giving up anyway. So yeah.
Okay. Is PremedGo just in the UK, or is it in other markets as well?
So PremedGo, it's in the UK and in Ghana slowly. So we are now. So we've got over 6 clinics in Ghana. We've got a customer also in Ghana. We are piloting. So PremedGo is slowly in Ghana. We are doing it on a low key to learn more about the market, learn more about employers, learn more about the needs in Ghana. But yes, it's live in Ghana. We've got people signed up. We've got a lot of activities going on. We've got a team as well in Ghana who are helping with driving PremedGo slowly. Yeah.
Okay. And so you've got a team in the UK and then a team in Ghana.
Yeah.
Is that the aim going forward, that there would be a team in every territory that you would, PremedGo would set up?
Yes. So that's the aim, that our chief operating officer will be leading teams in Ghana, and also we are looking to put up a team in the US to do the same thing that they're doing in Ghana, pilot it, learn from the market. We've done a lot of paper exercises on market assessment, market analysis, and I've done a lot of that in my academics. And I believe that works, but I also believe that having the real market, knowing about what a customer actually wants and how it works in it, is also quite key. So we're also going to get a team in the US as well. Got a very active, vibrant team in Ghana who are pushing the PremedGo agenda. They're coming up with all sort of ideas, some crazy ideas, some very fantastic ideas. And it's quite lovely to actually see all these things coming to light. Yeah.
Why Ghana?
Yeah, Ghana, because I selfishly come from Ghana. So I was like, if I'll trial something, I'll trial it in a country I know, a country I grew up from. And that is quite, that is not always, I won't say that's not always great, in a sense that you might end up adding some biases to it, but in terms of knowing where to go, where to start from, what to do, what not to do, it actually helps. So that is why I chose Ghana, and I thought, listen, it will be easy to also, because I understand the local languages, I understand the local communities, I grew up there, so it'll be very easy.
And you'll have a network of contacts.
A huge network of contact. So it's quite great. And also our first client, our first provider is also like my classmate as well. So it was like, it was so good, because having that provider on was able to give us access to all these other providers that we have now. So so that's also another point.
So George, when you look at a territory or a country, how do you evaluate whether it would be a good fit for PremedGo?
That's a very interesting question there. So when we pick a country, what we look at is, okay, what is the healthcare system in a country looking like? Is it a country with a reactive healthcare system, or a country with a preventative healthcare system? So let's say I'll pick a continent. So when you look at a continent like Africa, the healthcare system is very reactive. You've got people who don't have money to spend on healthcare. You've got a situation where people are dying in hospitals only because they don't have the necessary funding. But the other question is, do these people have the necessary funding to prevent these reactive illness or diseases? And the answer is yes. This is based on pure research. We had a similar research as well in the US, in Los Angeles, whereby you find out that people don't have access or don't have money to buy insurances or pay for treatment, but these same people can spend money on prevention. And this is how we're able to pick the country. Look at the country, look at the population needs, look at the demand, and start trying to map how PremedGo can help not only the system within the country, but also the individuals within the country.
So it's interesting because obviously you talked about the US market, which is the LA market, as you mentioned, and then you also talked about the African market. But the healthcare system in both these markets are really very, very different.
True.
So you're using two different, as an example, so you're using the same tools to evaluate, but you have to change your evaluation or assess the suitability of PremedGo depending on two completely different healthcare systems. As long as there is a demand for something like this, as long as that there's a demand for moving from reactive to preventative healthcare.
Correct. That's very true because so I pick the US and Ghana and the UK. So in Ghana, US, the model is different. It's the same platform, everything is the same, but the model is different. The model in Ghana or Africa looks like a 1-1-1 model, whereby preventative health is driving it. So in the sense that, so we sort of call it something like PremedGo 1-1-1 prevent, because prevention becomes the forefront of that 1-1-1 model, whereby someone rings, they're not well, blah blah blah. But this time, you sort of interact with AI on WhatsApp, because that's the access to internet. Most people in Ghana have WhatsApp, most people in Africa have WhatsApp. So they go on WhatsApp, they chat with their bot instead of actually going on an app using the internet. So they'll chat with their bot. It's able to help them. It's able to try and solve some problems. If it can't and they need to see a clinician, they'll just send them straight to the clinician. The clinician will then maybe call them or whatever the process the clinician needs to follow. Then if that is not being resolved, the clinician then signposts it back to the platform, and the platform is able to help this person, looking at where the person is based, looks at a clinic closer to the person, automatically books the person into a clinic. If there is a need for an ambulance, it automatically also books for an ambulance. The whole thing about these continents is to prevent death. So we are looking at prevention at all costs. So when it comes to these continents, we want to prevent death. We want to also prevent long-term illness. We catch it, it's being sorted, then the people are able to have a personalized plan to deal with it. When you come to the UK, what we want to do is also very different, because we just want everyone to know that, listen, if you want a quick health check done, you can't get it with your GP. You can actually go on the platform. It's not as expensive as people think. And I always tell people, listen, people think maybe, you need to spend 500,000, 2,000 pounds for a health check. I'm like, no, listen, it's like you sacrificing 3 kebabs. I like kebabs, so sacrificing 3 kebabs, you can have an easy health check. Or you want to go to a nice restaurant, so sacrifice 2 restaurant visits. You can have a health check to know where you are at. And I think everyone sort of needs to take control of their health, know what's really wrong with them, regardless of how healthy you think. You need to have a full, like, if I have this magic wand, I'll just give everyone easy access to health check at the start of every year, so you know where you are at, where your blood levels are, where your sugar levels are, what you need to do, what you don't need to do, so that you can live a healthier life in a year. So I think that's how.
And then in terms of what is key for succeeding in these markets, is it partnerships with the correct medical advisors, medical providers? What do you think are some of the key things that PremedGo has to look at or must have in place for it to succeed in these markets?
I think partnership with medical providers, and we are fortunate to have you driving most of the recent partnerships. Like you bringing on scans.com, so everyone comes on a PremedGo app can get access to whatever scans they need. All the partnership you drive in, all the access to over 3,000 clinics available to people. So having a right partner, having the right sort of provider that people can go to is very key, because when people have them, they can actually book and get access. Because the biggest challenge we have now is everyone is struggling with access to appointment, access to a doctor. But if there's an alternative, and once we have a lot of these ideal or good providers, it creates a market of alternatives in terms of pricing, location for people, and people can have that easy access we want to promote.
Yeah. Okay. And who do you think needs PremedGo the most?
This is a good marketing question, isn't it? And I might fail at my first attempt. But I think for me, we framed or reframed PremedGo and sort of mapped it to employers. I believe that every employer with an employee, from one employee upwards to 1 million employees, needs PremedGo, because if the employer wants to be part of the employee's life, not only getting the employee to work or providing the employee with insurance, which is great, but insurance is really good when you can activate it.
Yeah.
It's like driving on the motorway. If I don't try and prevent myself from staying focused or crashing into somebody and start thinking, okay, I can go 120 mile per hour because I've got insurance, it's no good to me. It's not good to everyone. So that is how I'll frame it. Every employer needs to have an element of PremedGo. It doesn't have to be having a whole full suite of PremedGo, but actually knowing that, okay, this is prevention. I'll give this access to my staff so that they can use it and prevent anything that they don't even know about. I think that will be.
Okay. And what are the top priorities for PremedGo in the next 6 months?
So it's a very, very good question. So for the next 6 months, we have been piloting our MVP. So our MVP is a marketplace. Now we are bringing in AI, and we've been very fortunate with Innovate UK funding to actually fund us to build our next phase of our AI. So we are now building our predictive analysis, risk scoring part of our AI, whereby it will be able to predict. So a user comes on board, it can predict, it can risk score the person, then automatically triage the person to what sort of preventative needs they need. Because early days of PremedGo, people used to say, hey George, do you have a doctor within your team? I want to know what sort of preventative health package, what do we need? Can you bring a doctor on site to tell us? We want to eliminate the need and cost on employers by bringing in a physical doctor. But now we build this AI model whereby it can actually do that job and then signpost them to the right doctor or right mental health physician or right dentist or whatever that person needs. So that's what we're looking at doing first. Then also the next thing we want to do is to try and pilot in the next 6 months. We are looking at piloting we've done a lot of research in Ghana, we've done a lot of research in the US, so we are looking at piloting in Ghana and in the US as well. So these are the key milestones for us in the next 6 months.
Okay, and in terms of the tech development, I assume that's all going to be unique.
So that they're all going to be unique, patent. We're building our own models. We are testing our models, and we want it to be very unique in a sense that we're using quite clever people to build our models. I'm quite proud to have a team full of clever people.
Okay. So obviously there's been a lot of in the press about NHS and government putting a lot of emphasis on setting aside funding for preventative healthcare. How do you see PremedGo playing a key role, given this is the buzz thing that everyone's talking about? How can PremedGo capitalize on this?
Interesting. To me, I don't really support any political party, but for the government saying, listen, we want to invest in prevention, maybe the government is doing, maybe the government is not. But for where I say maybe the government is doing it is we applied to the Innovate UK Catalyst grant fund, and we got the maximum fund. Our proposition was we building something in preventative healthcare that will help SMEs, that will also help the NHS in the long term. And our value proposition sort of was selected, and the government has invested this money in it to help us build a prototype. So the funding is not even to build the whole suite of what we want to do. They've given us this funding to build a prototype. So it looks like, okay, wow, okay, maybe the government wants to build or to encourage startups within the preventative healthcare industry.
Yeah.
So that's how I see it. So we are fortunate to be one of the organizations selected to build a prototype within the preventative health care industry.
Okay. Okay. I think it'd be quite good now to talk a bit about yourself.
Yeah.
So what personally motivates you as a leader?
So I think impact and integrity. So impact in a form of, like we are, and we, because I can't do everything by myself anyway. Without a team, I'm as useless as any other person anyway. So we are building something that has value, brings value, and commands value. So that is what, like, as a leader, that's what drives me. What we building, it adds value. It will create a job. It will create an employment. We'll interact with the provider. So in terms of economy, the economy is moving, and also in terms of value, we're thinking about human health. We want people to live longer. We are interested in picking things up, detecting things, and that is what, as a leader, in terms of impact, it means a lot to me in that sense. So I'm not too worried about things. I'm so worried that are we creating value in what we do? And that is the most important thing for me as a leader.
Okay. And then how do you stay motivated through the challenges? Because clearly, PremedGo, having started its journey, it's had its fair share of ups and downs.
Yeah.
How do you motivate yourself through that uncertainty and challenges?
So my motivation comes from I listen, like, well, everyone, people will have different views after this, but I don't want to fail, and I don't think I should fail. Not that I can't fail, but because I don't want to fail and I don't think I should fail, I give everything I do my 110%, because at the end of the day, it has to be successful. So I do everything, and I think the only thing that can stop me from being successful is death. But so far as I'm alive, we have to get to the end of Premed. We have to get to a phase whereby everyone is using PremedGo. Either they're talking about PremedGo, they're criticizing PremedGo, or they loving PremedGo. And that is what drives me, because I think that is achievable. You can get people to criticize, it's good news. You can get people to love it, it's fantastic news. And that is one thing that drives me. The other thing that drives me is the people around me, because I normally try to surround myself with people who I believe are smarter than myself. No disrespect to people I don't believe they are smarter than myself. That's their own opinion. So my team as well is, and trying to get these people like yourself to join PremedGo. It's one of those things that keeps me happy, because when I look at my team, I'm like, yeah, this is it, dream team. We can actually make it, and we'll make it.
Okay. And then what advice would you give to other health tech founders?
So listen, I'm not too successful, but with a little bit, I will say is that you just need to create something, or the business you are creating, you have to think about it. Even if nobody pays for it, is this something you would do? So if you think it's something you will do as an individual, regardless of somebody paying for it, you just have to go with it, and with time, it will work. One of the biggest challenges is going on social media, seeing everyone is getting funding and everyone is talking about 3x, 5x, 100x, 30x, and you might end up demotivating yourself because at that point maybe things are not working for you. Everything is not working anyway. It doesn't mean you failing. It means that you just need to keep pushing. And I always keep saying that you need to push, 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 push until it breaks, because the more you push, it will break. But if you push, you sit back, cry a bit, start thinking about what next. Oh, can we do this? Can we do that? Can we do this? You just become confused and nothing works. But you just keep to your vision, continue pushing it, and maybe also listen to work with your team, get your input in it, and yeah, you get to where you want to get to.
Okay. And what legacy do you hope PremedGo will leave behind?
For me, I want PremedGo to be that platform that continues saving lives. In terms of, like, people find things out, they solve it. Find things out, they solve it. I want PremedGo to become like, when people have their annual service or have their MOT, you have your annual service, they tell you, listen, change your brake pads, change oil, blah, 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 blah. If you don't change your brake pads, you might end up getting into an accident because you brake and it won't brake. And that's how I want PremedGo to be. Like, it's that platform that people pick up at the beginning of the year. Normally, I remember when at the end of the year, beginning of another year, you like, listen, I'm just gonna go to the gym. I'll sign up. Listen, that thing never worked for me anyway. I sign up to the gym, I never go to the gym. So you do that thing, I'm signing up to the gym, I want to be this kilo, I want to weigh this level at this time in 6 months. I want people, when they having their New Year resolutions, New Year plans, to say, listen, I'm just going to use PremedGo to have a first health check. I'm just going to have a first mental health check. That is the legacy I want PremedGo to have. That everybody, even if you draw McDonald's now to every kid, including my children, they know that this is McDonald's, this is where I get burger. And that's what I want PremedGo to do. You see the PremedGo logo, you know that, okay, this is what I need to prevent or find things out about myself. And that's the legacy I want PremedGo to leave behind.
Okay. Thank you, George, for joining us today and telling us all about PremedGo. Next time, George will be interviewing one of our clients, so watch out for that one. Thank you all for listening to us.